Welcome to this clinical walkthrough. Today, we're going to master the sterile wound dressing change. Our goals are twofold: execute a strictly sterile procedure to prevent infection, and keep our patient safe and comfortable throughout the process. Before approaching the patient, you need to gather your tools on a sanitized bedside table. This checklist graphic shows exactly what you need: a sterile dressing set, 500 cc's of normal saline, sterile dressing pads, sterile gloves, betadine solution, a crate bandage, sterile gauze, cotton, and adhesive plaster. With your equipment ready, verify the patient's medical orders. Specifically, check if there are any active orders for blood product transfusions. If the patient requires pre-transfusion medication, you must administer it at least 30 minutes before initiating the dressing procedure. Now, move to the patient. Pull the curtains to ensure their privacy. Verify their identity by checking their ID band and asking them to state their name, and explain exactly what you are going to do and why. Handling these logistical and communication steps first means you won't have to break your sterile field to check a chart or calm a startled patient later. Meticulous preparation is your primary defense against protocol breaches before the physical procedure even begins. Step 1 at the bedside is proper positioning. Adjust the patient so the wound is easily accessible. Place an incontinence sheet underneath to protect the bedding, and set a kidney dish near the wound site to catch any fluids. Next, open the sterile dressing set. To avoid contaminating the inside, use your fingers to peel back the packaging by manipulating only the outermost edges. Lay out your sterile gloves on a separate table to keep them completely isolated. Then, pour your betadine antiseptic solution into the galley pot, the small medical cup in your kit, and add the sterile gauze you will need for cleaning. Put on a pair of clean, non-sterile gloves. You are now ready to carefully peel away the old contaminated dressing. If the adhesive tape is stubborn, do not pull forcefully. Instead, take a moistened medical swab and gently rub it along the tape's edges to loosen the bond and minimize the patient's discomfort. As you can see in this split-screen diagram, once the old dressing is off, it goes straight into a yellow biohazard bag. Remove your dirty gloves and drop them in that same bag. Then immediately perform a thorough hand hygiene routine. By completely removing the contaminated materials and sanitizing your hands right now, you create a hard break in the workflow. This ensures the old bacteria cannot cross-contaminate your new sterile field. With clean hands, transition to the fully sterile phase of the procedure. Put on your sterile gloves and arrange the equipment in your tray according to the exact order you will use it. Take the gauze soaking in the antiseptic solution and squeeze out the excess liquid. You must do this using your dominant hand only, ensuring you maintain strict control over the sterile instruments. The strict rule is 1 stroke, 1 swab. Swipe exactly once across the wound bed, then drop it into the disposal dish. Reusing a swab pushes bacteria back. Always use a completely fresh swab for a new parallel stroke. Once the wound is chemically cleaned, repeat this exact process using dry gauze swabs to remove any excess moisture. The strict single-stroke rule applies directly to drying as well. To apply the final dressing, you need clean tools. This flowchart breaks down the transfer. First, drop the dirty forceps from your dominant hand. Then, take the clean secondary forceps in your non-dominant hand and pass them over to your dominant hand. Now that your dominant hand holds a completely sterile instrument, you can safely pick up the new dressing and apply it directly onto the incision site. Secure the dressing firmly in place with adhesive tape and gently remove the plastic incontinence sheet from beneath the patient. Rigid adherence to the single-use swab rule and the sterile forceps transfer protocol is the only way to guarantee that the dressing now covering the wound provides a truly sterile environment. Your sterile work is done. Remove your gloves, dispose of them correctly in the yellow bag, and perform your final hand hygiene cycle. Before stepping away, secure the patient's environment. For patients in a fall risk category, as shown here, verify that the bed's locked side rails are pulled into the upright position. Ensure the patient is comfortable and the surrounding unit is left clean. Return your equipment trolley. Moving forward, you will need to continually monitor the patient's status and regularly check the flow rate of any active intravenous fluids. At this point, the physical procedure is finished, but your task is not. You must document every step you just took in the patient's chart. Only when the record is fully updated is the procedure medically and legally complete. securing both institutional compliance and patient safety.